Now, millions of poor South Africans could be prevented from receiving decent health care because of corruption in public health systems. Now, a report by Corruption Watch has found that the entire system is plagued by maladministration, and the COVID-19 pandemic is making calls for a system overhaul even more urgent. As South Africa moves towards the peak of the pandemic now, concerns are mounting that our already strained public health facilities will not cope. Corruption Watch says it's received more than 700 health-related complaints since 2012, with those most affected being the elderly, women and children. Let's unpack the story now with political analyst Lukhona Mnguni, who joins us via our video line this morning. Lukhona, thanks very much for your time on the AM report. I mean, this was one of the big worries going into the COVID-19 healthcare system, particularly, I think, when the president announced that 500 billion rand COVID relief package. The big worry was how much corruption are we going to see, specifically at local government level, and that question has now been answered.
Well, indeed, Michelle, it has been answered in many ways, given the various allegations we have seen in the media. And we've also seen the SIU, Special Investigation Unit, taking a proactive stance, approaching the president to sign a few proclamations so that they can begin some work in terms of investigating some of these allegations. We've seen people blowing the whistle through social media on various councillors, whether they were hogging water tanks in their homes or they were misdirecting food parcels and all of that. But I think just coming back quickly to this Corruption Watch report, on the health system itself, we've always known that we have a broken health system. A number of activists have done remarkable work, at times with the help of the South African Human Rights Commission. If you remember, at some point in KwaZulu-Natal, for example, province upstate, for some time, there was a big issue on oncology services for cancer patients, and how some oncology equipment, particularly in hospitals like Edington in Durban, were left derelict, not serviced, and therefore patients were out of it. I've had my own experiences where you can't even get a relative in a hospital as big as King Edward, the 8th hospital, unable to do a colonoscopy, and then they have to be referred to Chief Albert Luthuli Hospital, and then there's almost like a 5 months waiting period just to get a colonoscopy, which is an investigative procedure, and then you get to be administered some level of remedy. So without the investigation, there's no remedy. So that's the type of health system we had going into COVID-19, and that's why I was always skeptical of the lockdown philosophy, that it is about preparing the health system.
Yeah.
Because in mind, I knew 3 weeks would not be enough to prepare it.
Yeah, and you know, the thing about what you've just described there now about cancer equipment, something simple like a colonoscopy, an investigative procedure, what that has led to, and we've seen the stories in the media time and time again, is that people die before they can get the help they need.
No, absolutely. We have a health system that is not necessarily designed to save lives, as we've been saying. In fact, it puts the lives in jeopardy. And I think all of us, in one way or the other, have so many stories at a personal level and at an anecdotal level about the public health system. If you go to my hometown, for example, in Flagstaff, in the Eastern Cape, and you go to Holy Cross Hospital, I mean, at some point, there wasn't even water, and patients had to be brought water by their relatives. I lost a friend there who, needed an ambulance. There was no ambulance in the hospital, and they had to wait for an ambulance coming from the nearby town, Lusikisiki, and by the time it arrived, he had unfortunately lost his life. So that's the chronic poorness of our health system, and being underserviced, being ill-equipped, and of course the facilities there just not coming to the party. And we've seen so many of these stories, Michelle, even you guys have reported on some of the dilapidated health facilities across the country. And I think it really takes away people's confidence that if indeed I needed to in that facility, I would be catered for in a manner that will save my life.
Yeah, absolutely. So just what you're saying now just puts into perspective what the health minister has said after his visit to the Eastern Cape to inspect health facilities there. I mean, it took a BBC report on blood in the corridors of one hospital, human feces in the corridors of one hospital meant to treat COVID-19 patients and many other patients who were at risk of losing their lives. In some instances, women who were in the middle of giving birth. But the health minister, yesterday, we hear him saying, his department will not take over the administration of the health department in the Eastern Cape. Yes, more work needs to be done in the province, but he says he's comfortable with how the Eastern Cape Health Department is run. I mean, surely that cannot be, Lukhona.
I mean, I think a number of us have been asking what is it going to take for the Eastern Cape provincial government to be put under administration, particularly during this period of fighting the COVID-19 pandemic. But remember, Michelle, administration is a very political weapon to use. And you won't want to upset your political allies by appearing as having or giving them a vote of no confidence. And unfortunately, politics do get in the way of governance. And that's why at times when we talk about the governance problem in South Africa, we also talk about the problem of the political culture in the country. And that the political culture needs to change and be more inclined towards accountability. We just don't have an accountability culture. All people in positions of power are very much relaxed and comfortable when they have to go cut ribbons, showcase what they have to unveil to the public and so on. But when it comes to accounting, they are at pains at doing it, and they always do the bare minimum that is required. And of course, as you are saying, Michelle, it took a BBC video and story, but that story has been told numerous times by local media, and that shows you the impunity with which our leaders treat our local media. They will give media freedom, they will give the space for the media to do its work, but they are not responsive enough in terms of what comes out of our local media. And then when it goes international, they want to save their face because now they feel embarrassed. Because remember, South Africa has been hailed by the WHO as one of the countries that have responded better to the coronavirus. Now, when these stories go international about the poorness of the health system, it casts the government in bad light, then they want to respond. And I think that is something that we need to change going forward, that if we respond on time with the right amount of resources and personnel to crises that we face, we will be much better prepared for the next wave of some crises that we will face and needing some health system response.
No, absolutely, and that's what COVID-19 has done, isn't it? It's exposed the existing cracks in our systems, not only in healthcare, but in pretty much every sector, economic, our employment numbers, and the list goes on and on. Lukhona, just in terms of, you talk about accountability being a real problem when it comes to governance in South Africa. Why can't we just have the real-time documentation of every tender, including healthcare tenders, so that there is that transparency, so we know where every cent is going?
The more you conceal the information, the better it is for you to continue with misappropriation of funds, irregular expenditure, and all of that. I think we need to go back and probably redesign the entire procurement system in South Africa. I have flagged the question of the tendering system for some time, and there doesn't seem to be appetite in government to engage this procurement system problem in earnest. Because one of the issues it creates, Michelle, is just the ease at which we've seen now, even KZN Premier gave his statistics, inflation of prices in the tendering system, where one service provider offers a blanket at 350 and another at 550 rands. Now, we need a cost capping framework as a start, because it won't assist us to have the government departments detailed to us in a transparent manner, uploading on their websites who has gotten what tender and what procurement bid, if we do not have other checks and balances in the system. And a cost capping framework says, as a client, I know how much a product costs in the market. I won't be able to pay for it at much more than this markup from any service provider.
I mean, these are basic things, Lukhona.
No, it's a basic thing, but it's something that has not been adhered to. If you remember one time, Jeremy Cronin, when he was still Deputy Minister of Public Works, he went carrying a glass to a parliamentary portfolio meeting, and he said, we hire these at 120 rands and we still don't own them afterwards. So that's the perverse manner in which this system has been exploited. And until we talk about the procurement system in South Africa, at the tail end of transparency is going to be an exercise in futility, because the misappropriation and the maladministration would have occurred prior to the declaration of who has gotten the tender. Indeed, there is a great deal, Michelle, that is needed, even on how we account, because we still rely a lot, if departments don't want to disclose, on prior applications. And now we all know how arduous and expensive prior applications, because in terms of the Promotion of Access of Information Act, if the accounting officer doesn't give you the piece of information, your only relief is to go to court. But how do people who reside in the locality of these government institutions who get the services hold accountable those institutions? And that's why there are now growing calls in civil society spaces that probably we need to reinitiate initiatives such as social audits, and making sure that the accountability framework centers citizens to be able to demand information without necessarily having to pay so much for accountability to come to the fore.
Incredible that we're still having this conversation. Lukhona Mnguni, thanks very much for coming on to the AM report.